All right, guys, howdy and welcome to our Poop Scoop Monday. We have a great show today. So, as usual, we'll go over any questions you guys have. Put them in the comments down below. So, today we'll talk about healthy gut snacks, quick tips to help out with your digestion. We'll talk about how to survive the holiday feast. You guys know this is the time of the year. We have all the holidays. I love Thanksgiving. We'll give you my recommendation of what you can do to hopefully help out with your gut so it's not going too crazy during the holidays. We'll discuss some over-the-counter awesome remedies you can help out when it comes to your gut issues as well. Sorry, I'm trying to get my computer ready. We'll talk about also what it means when you have burning diarrhea and how to stop it. And we'll talk about, you may have seen this, a basketball star, PJ McCollum, had a collapsed lung. What is going on and what does that mean? And your questions live in today's Poop Scoop Monday. So howdy y'all. I'm Dr. Islam. Yes, I'm your poop guru. Every Monday I go live to answer your questions you guys may have. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, here's what I need you to do. Number one, let me know if you're watching this live or on the replay. And also let me know where you guys are watching this at as well. Love to see where my audience is at. Last week had a couple people from overseas. So let me know in the comments down below where you guys are watching at. Raymond, thank you for watching in Idaho as well. All right. It's a couple of life updates. Number one, I don't know if I told you guys this. I'm a cat person now. Oh, gosh, I know. We have 2 cats. It is killing me because I've never had cats before. I am not a cat person, but apparently I've become a cat person now. So my kids are obsessed with these cats. So is my wife. And so, yes, we have 2 cats. Oh, my goodness. I've always thought of myself as a dog person. I've had dogs growing up, but now we have cats. And yeah, it's been a very interesting couple of weeks having cats. So that's a life update for me. Number 2, I'm still going through my movies, trying to show my kids older movies, which technically are movies when I was, in my teens. So last Saturday, we watched Primal Fear. Listen, great movie starring Richard Gere and Edward Norton. This was Edward Norton's, I think, acting debut, and he was nominated for an Oscar. Great movie. I loved it. If you haven't watched it, be sure to watch it. Let me know in the comments down below. If you have a recommendation for the next movie, I'm thinking I may introduce my kids to The Fugitive, the Harrison Ford version. I don't know, but let's see. They have not seen that yet, so I'm curious to see what their thoughts are on that. Sorry, I have allergies acting up right now, so let's see how that goes. Big football weekend, as usual. Cowboys lost, but it is what it is. But the UT Longhorns, yes, we won. We barely won. Oh my goodness. This team is killing me. It's getting like indigestion, heart attack every single week. So I just hope we can make it through the rest of the Big 12 Conference. For those of you guys who are Tech fans, all right, guys, you guys won. Yay. I mean, but you know me. I'm not a Tech. I'm a diehard Longhorn. Sorry, but, it's who I am. Sorry about that, guys. And then lastly, I'm reading a great book and finishing up on the Marvel Cinematic Universe. So I've been a big Marvel fan. I watch all the movies. So this is a great book on kind of the ins and outs of what's going on there. It's really fascinating. Just some of the connections, how they got actors, the behind the scenes that happen in terms of the whole Marvel Cinematic Universe. So it's a great book. I'm almost done. I'll give you my review on it once I am done with that as well. All right. Raina, thank you for watching from Pennsylvania. Leslie from Lubbock. Atlanta. Janelle. Cats are entertaining. Oh my gosh. I am glad you're enjoying your cats. Javier in Mexico on a cruise. All right, that takes the cake so far for the best place. Janelle, The Goonies. Yes, I'm going to introduce my kids to The Goonies, so I thank you for reminding me because I'm going to add that to my list of movies that I'm going to show them. So thank you for doing that. All right, let's talk about number 1. Healthy gut tips. So there are a couple of things I recommend to my patients who I wish they can do to help out with their gut. Here are a couple of tips that I'm going to recommend that you can start doing today that I think is going to help your GI tract and get you feeling better. So tip number 1 is to make sure you add fiber. Everything starts with fiber. Fiber is that foundation for gut health. Without fiber, you can't build everything on top of that. Fiber is like the miracle drug, the miracle pill, the miracle food that really is the foundation for gut health. And that's where you need to start your gut journey on, is having adequate fiber. That's the first thing we recommend. Number 2 are certainly things like probiotics. These act as supplements for your gut. So think of fiber as a natural fertilizer to improve your natural gut immunity and your natural gut microbiome. Supplements are like reinforcements you could add into your GI tract to help you get going and to help improve your gut microbiome as well. It's the second thing I recommend. Number 3 is exercise. We have seen studies after studies that's showing that exercise itself will actually change your GI tract. Roughly 60 to 90 minutes 3 times a week. If you can get that to about 180 minutes at least per week, that is all you need to literally make a change in your gut microbiome. So if you can do that, adding that exercise is going to help out. Number 4 is avoiding the toxins that destroy your gut. So there are a couple of them that we know can really mess up your gut. Alcohol does. Cigarettes do. We know that taking unnecessary antibiotics will mess up with your gut as well. So try to minimize the things that you don't need that's going to make things harder for you to improve or repair your GI tract. And then lastly, stress. Stress plays a huge role in everyone's life, my life, your life, everyone's life. But the idea is to not have stress because that's impossible. The idea is to find ways to manage your stress effectively. So these include things like exercise, meditation, prayer. These are the most effective ways that you can do to not only manage stress, to get your stress taken care of, but also get you feeling better as well. If you do these 5 things, you will be 95% better and on the road to improving your gut than 95% of the population out there in the world. If you do this, you'll start to feel better, and then slowly we can make tweaks and changes based on that. Let me know in the comments down below if you made these changes. Has it helped? Has it worked? Has it not worked? Let me know. I'd love to hear what you guys have to say. Once again, if you're joining for the first time, my name is Dr. Islam. Yes, I'm your poop guru. I want you to smash that like button, like, share, and subscribe. Let me know if you're watching this live or in the replay. And come see us Love at Gastro for all of your GI needs. All right. So Rand asked, does milk thistle help with the gut? It's a very good question. Let's talk about this. So good question. We do not have any evidence that milk thistle helps out with the gut. Now, there may be some small evidence that it possibly could help out in some liver conditions. Now I'm not saying that you need to take milk thistle to help out with your liver, because there are more effective options to help out with your liver: avoiding alcohol, losing weight, Mediterranean diet, black coffee. These are more effective options, but there is no evidence that the milk thistle can help out with your gut. So if you're hoping to help out with your gut, I wouldn't even go down the milk thistle route. Do some of the other things I talked about, whether it's adding fiber, adding probiotics, improving stress, sleeping better, exercising. These are more effective options than trying something like milk thistle to improve your GI tract, because we don't have any evidence it's going to make a difference at all. Great question. All right. All right, perfect. So topic number 2, how to survive the holiday feast. Let me know in the comments down below if you are excited about the holidays coming up. Thanksgiving is my favorite holiday, but also let me know in the comments down below if you're worried what is going to happen with your gut. Now, Thanksgiving, Christmas, I love this time of the year because for me, it is time for me to, enjoy life, be with my family, be with my friends, but also enjoy the yummy food. I love Thanksgiving. But for a lot of my patients, they dread this time of the year because of all the food and all the gut issues they may be having with this. Here are some tips I'm going to recommend to help you navigate these holidays so we can get you feeling better. So, tip number 1, be mindful of what you're eating. Really try to incorporate mindful eating. Here's what I mean. A lot of us, including yours truly, just ends up eating food without realizing exactly what I'm eating, how much I'm eating, or what I'm putting in my mouth. And we do this often when we're around friends, when we're talking, when we're watching TV. What I want you to do is be very mindful of what you're eating. Actually look and see, do I want this food? Do I even need this food? Or am I just eating because I'm just in the habit of eating? Be mindful of what you put in your mouth, because you may not realize you could be eating a lot more than what you really anticipate and you can be eating things that are not good for you or good for your gut. When you look at the studies of those individuals who try to measure how much they eat, people vastly underestimate how much they're eating compared to the actual food that they are eating. They actually are eating a lot more than what they think, and it's because they're not mindful of what they're eating. So really keep that into play so we can really understand what you're eating and why. Tip number 2, try to have portion control, meaning don't fill up your plates with all the yummy stuff first. The first thing I recommend is to fill your plates up with vegetables, salad, and plants. Make that the vast majority of your plate and have meat as almost like a garnish or a side on there. That's what you need to do, because having that portion control is going to allow you to really load up on those vegetables, but minimize some of the foods that are not going to be good for your gut and good for your gut microbiome. Tip number 3, it's going to sound weird, but actually slow down your eating. A lot of us eat really fast, even during the holidays, because of the habit of eating fast during work. So if you literally slow down, guess what's going to happen? You're going to be mindful of what you're eating, but you're also going to realize you actually are full and you may not be eating as much as you need to. So really be slowing down when you eat. Number 4, eat to being satisfied, but not eat to getting stuffed or getting full. The best recommendation I have is make sure you have 1/3 of water in your stomach, 1/3 of food in your stomach, and leave 1/3 for air. This is going to give you enough calories to at least feel satiated, but not feeling overly stuffed with what you're eating. And then number 5, last thing, enjoy yourself. This is what the holidays are for. It may be one day when you're eating bad, but enjoy that time. Don't make it so, I have to make sure everything's okay. Enjoy the time with the family. Enjoy the time with your friends. And I want you to enjoy the holidays, because it's not always all about what we're eating every single time. If you want to enjoy it, it's okay. Listen, I'm going to enjoy Thanksgiving because I know for me, this is the time that's one of my favorite times of the year, and I enjoy having the food for my family and my friends as well. These are 5 recommendations I have. Let me know in the comments down below if you would add anything else on here, because I know my audience would love to hear what you guys have to say. Once again, if you're joining for the first time, my name is Dr. Islam, and yes, I am your poop guru. My passion is to give you accurate information every Monday at this time. If you haven't already, come see us at the Gastro for all your GI needs. Smash that like button, like, share, and subscribe, and let me know if you're watching this live on the replay, and also let me know if you have any questions as well. So Raymond says I'm breaking up. Can you guys let me know if I'm breaking up as well? So Leslie asks, do I have a fiber that I recommend? So here's when it comes to fiber. The most important thing is that you have the term called psyllium, P-S-Y-L-L-I-U-M in it. This is the fiber that you need to help out with your GI tract. What fibers have psyllium? Guar gum, acacia powder, sometimes also benefiber, or also citrusel. These are fibers that actually are fibers that you can add on that has psyllium in them that are good for your gut and improve your gut microbiome without all the side effects that some of the other fibers may have as well. So keep that in mind. The most important thing when it comes to fibers that has the term psyllium in it, because that is the type of fiber that you need to hopefully get your gut going and give you the foundation that you need to help out with your gut microbiome as well. Let me know in the comments down below how your experience has been with fiber, or if you have any questions when it comes to fiber as well. All right. So topic number next. Next we'll talk about your kitchen cabinet. Did you know that your kitchen cabinet may already have some of the do-it-yourself recipes or treatments when it comes to common GI conditions? A lot of my patients don't realize that a lot of their conditions that they have actually may be in their kitchen cabinet or in their kitchen. So here are things that you may need, kind of a power pack or a rescue pack of some things that you can do when it comes to GI issues. So number 1, nausea. Very common symptom and complaint that I see. One of the more effective options you can do that you may actually have naturally in your kitchen is ginger. So ginger has been very effective. It's been used for thousands of years when it comes to nausea. It helps to settle the stomach. It also changes the receptors that goes on when it comes to nausea. Now, there are a couple different ways you can take ginger. The best way, honestly, is ginger root, or where you soak ginger in a hot glass of tea, and that'll help out. But if you don't have that, adding ginger supplements or having a ginger tea is going to help out with the nausea. So if you're eating something yummy or enjoying the holidays and you realize, oh man, I overate, I have some nausea, have some ginger. You may find this in your cabinet to help out when it comes to nausea. That's kitchen cabinet health hack number 1. Number 2, indigestion. Very common to have that pain or bloating that you have. An effective option for that is peppermint. So peppermint has been used for a long time to help out when it comes to gut issues, and it's one of the most effective options when it comes to indigestion. So whether it's peppermint tea, peppermint lozenges, or even peppermint gum can really soothe the stomach. We've seen evidence that peppermint can actually relax the GI tract, allow things to settle, and also helps out with indigestion and upset stomach as well. So if you're having an upset stomach or you're having some cramping and bloating, don't feel very good, having peppermint is one of the more effective options to control that naturally so we can get you feeling better. And sometimes we can use a medication called IB Guard, which is an over-the-counter peppermint supplementation, which is released inside the gut to help out with IBS, bloating, and pain as well. That's kitchen hack. That is kitchen hack number 2. Number 3, diarrhea. Very common symptom that people have. One effective option to treat that is bananas. Yes, bananas are a great natural option to hopefully get your diarrhea controlled. So bananas have minerals and ingredients to help out with the binding of stool, but also gives you the electrolytes you may be losing when you have diarrhea. So if you have somebody who may be having some gastroenteritis or some viral infection or some acute diarrhea, bananas are a very effective supplementation you can give to help out when it comes to diarrhea issues, to get you feeling better and to get your bowels taken care of. So these are 3 kitchen hacks that I recommend to try and implement to get your GI tract taken care of. Let me know in the comments down below if you would add something on there. Have you tried these things? If it's worked or if it hasn't worked, I know me and my audience would love to hear your recommendations on that as well. All right, I'm going to check one thing really quick. Can you guys let me know if the microphone is breaking up? Because I was told some comments. Let me check one thing just to make sure on a connection here. All right, perfect. So far the connections are okay. So just let me know in the comments if you're okay, if you guys can hear that. So Ran asked, do I have any suggestions about traveler's diarrhea? Great question. So a lot of us, including myself, may be traveling for the holidays, and sometimes we can get some gut issues going on. Here's what I recommend. So number 1, I really would recommend before you go to load up on your fiber, you're going to give your bowels the option to improve the good guys. So have as much fiber as you can, just safely. Have a lot of plants and vegetables, and do this a couple of days before your trip. This is going to give you the natural defense mechanism that you need to hopefully improve your gut microbiome. Number 2, consider adding a probiotic. Things like Align, Florastor, VSL number 3. These are very effective probiotics that have been shown in clinical studies to help out when it comes to gut issues. So try to add that as a supplementation for what's going on inside your GI tract. Number 3, you may want to consider asking your doctor for a medication for traveler's diarrhea, because sometimes there could be a gastroenteritis you could be getting, or maybe even a bacterial infection you could be getting. So when I travel, I sometimes ask my PCP to provide for me an antibiotic that I can take in case I have traveler's diarrhea to help out. Number 4, I recommend taking some over-the-counter Imodium. Over-the-counter Imodium is an anti-diarrhea medication you can take in the setting of traveler's diarrhea to hopefully get you feeling better. And number 5, I always take with me IB Guard. This is an over-the-counter peppermint capsule that can help out when it comes to pain, bloating, and cramping, especially if you're having traveler's diarrhea. So I took this with me last time I took overseas because I actually suffered from a really bad traveler's diarrhea. I know, TMI, But I used my own tips to get me feeling better, and guess what? I got better very quickly. So these are 5 things that I recommend when it comes to traveling to make sure your gut is intact. Let me know in the comments down below if you would add anything, if you would change anything, or if you have any other tips for my audience as well. All right, guys, and thank you for watching. If you haven't already, my name is Dr. Islam, and I'm your poop guru. My passion every Monday is to go live to answer your questions you guys may have. If you haven't already, smash that like button, like, share, and subscribe. Let me know in the comments down below if you're watching this live or in the replay. So far, we have somebody on a cruise, Javier, who is watching this. So thank you for watching us on the cruise. And also let me know if you guys are where you guys are watching this at as well. And come see us at Lubbock Gastro, where we can get your GI tract taken care of. All right, next topic, it's going to be burning diarrhea. All right, let me know in the comments. I'm very curious if you, or maybe a friend of yours, suffers from burning diarrhea. This is a very common complaint that I see as a GI doctor. So why does it burn down below? Here are 5 reasons why it burns, and I'm going to give you 5 ways to stop the burning. Yes, you heard it here. So reason number 1, spicy foods. If you eat spicy foods, sometimes it can cause burning to occur. That acid feeling can go down into your bottom as well. In fact, I had a patient today who told me, I had a lot of chili with jalapenos last night, and guess what? My bottom burns. It's very common, especially in West Texas, to have these spicy, yummy foods that can burn your bottom because of the spices that are there, what's called capsaicin, which is also the nerve in your bottom that your rectum has that can be sensitized or feel that burning sensation that's there. So that's reason number 1. Reason number 2 is that you keep using too much toilet paper. Yes, that sounds crazy, but yes, you can. Wiping too much or always just trying to clean yourself down there can irritate the bottom, and that irritation in the bottom can develop what are called fissures or hemorrhoids, which can make it more likely for you to have burning down below. So sometimes using too much toilet paper can be a reason why your bottom burns. Number 3, I just mentioned it, hemorrhoids. Hemorrhoids are dilated veins in the bottom that can cause pain, bleeding, itching, and pressure. And it could be a reason why your bottom hurts. When you have a spicy bottom, those receptors that are there become very sensitive, and that's also where your rectum is at as well. And so that rectum and the hemorrhoids can make it more likely for you to have these symptoms from that to cause you to have that spicy bottom below. Reason number 4 is that maybe having some sort of gastroenteritis, whether you're sick, eating something bad, all that diarrhea, all that flushing out can cause irritation to occur down below to allow you to have some sort of problem going on there. And then reason number 5, you actually could be having a medical condition, whether it's a condition called IBS or irritable bowel syndrome, ulcerative colitis or inflammatory bowel disease, or maybe an anal fissure or some sort of medical condition. There could be a true medical condition in which a burning bottom could be one of the first symptoms of that. And always don't forget, rectum issues can also be a sign for some individuals of something bad going on in your bottom. So let's say that you suffer from this dreaded burning bottom. What can you do? Well, one of the things you can do, certainly number 1, is to adjust your diet. We know that spicy foods can make your bottom worse, and so sometimes maybe avoiding those foods or doing what's called a hell week when it comes to spicy foods can help out. Here's the idea, is that you have issues going on down below because of the receptors that help to understand what pain is. And sometimes you just need to give yourself a full throttle exposure to all that. So for some of my patients, I tell them go through a hell week of eating as much spicy food as you can, because when you do that, you start to desensitize how it feels like in your bottom. Now, that week is tough. Then that'd be one option that can help out, or obviously you can avoid those spicy foods. Tip number 2 is try to add more fiber to your diet. Fiber literally is like this magical pill that can help out with a lot of gut issues. Fiber is this magical pill that can help out with a lot of gut issues. And what fiber does, it can compact the stool, make it easier to go through, and make it easier for you to not have rectum issues. So sometimes adding fiber to your diet will help out. Number 3, consider dishing the toilet paper. Yes, I know it sounds crazy, but I'm a big fan of using something like a bidet. Bidets are fantastic. They're cheap. They're add-ons, they keep you clean, and they can prevent you from having issues down below. So really consider adding on a bidet. Next, it sounds weird, but let your bottom breathe. Some of us maybe wear too tight clothing down below, whether it's too tight underwear or too tight pants, and your bottom needs to breathe. It needs to feel the fresh air. Well, maybe not fresh air, but it needs to breathe. And so that can be a reason why you're having the issues. Hold on, my camera just stopped me. One quick second here. Perfect. All right, sorry about that. So what I was saying is your bottom needs to breathe, and it needs that air to allow it to do its thing. When it's too tight down below, it can irritate your rectum to cause you to have itching and burning down below. And then lastly, you know this, get those hemorrhoids fixed. Now, we offer hemorrhoid banding, which is a quick, easy, painless, no downtime procedure. And for the vast majority of my patients that have burning down below, and we think it's from hemorrhoids, we can get that fixed. So if you're having burning, or you know somebody who has burning, come see us at Gastro. We can find out the reason why. We can tailor treatment, and if it's hemorrhoid issues, we can get that taken care of for you as well. Let me know in the comments down below if you have any other recommendations for that dreaded burning diarrhea, because I would love to hear what you guys have to say. Perfect. All right, sounds good. Perfect. All right, so perfect. All right, guys. So, well, let's talk about one last thing because I don't see any other questions on there. I want to talk about what happened. You may have seen this on ESPN. CJ McCollum, who is a basketball star for the New Orleans Pelicans. CJ McCollum, who is a basketball star for the New Orleans Pelicans, just suffered his second pneumothorax. Golly, I can't speak today. Just suffered his second pneumothorax. So what exactly is a pneumothorax? What are symptoms? What are causes? And what can we do for this? Let's talk about this very quick. Let's talk about this in this. God, I cannot speak today. I'm so sorry. Let's talk about this. So we'll talk about what is a pneumothorax. How do you diagnose it? What are symptoms? And what are some treatments for that? So a pneumothorax is when your actual lung collapses. It shrinks down. Now, keep in mind, our lung is an organ that is expanding and contracting. It's filled with a lot of air and a pocket to kind of keep it in its place. When you have a hole in that pocket, it's like a balloon in which you have a needle and all the air comes out, and that causes your lungs to shrink. Now, there are a couple different reasons why. The most common reason is trauma to this area, whether it's getting hit in the chest, whether actually getting some sort of puncture in there. Now, we don't know in this particular case if PJ McCollum actually had some sort of puncture or what happened, even though he has his second one, but that's the most common reason. But the second most common reason is a spontaneous pneumothorax. So some people have what are called, the medical term is kind of blebs on their lungs, and these blebs can burst and bust open, and for some individuals that can cause your lung to collapse very rapidly and immediately at that time. How do you know if you have this? The most common symptom is just severe shortness of breath. You just cannot take a deep breath in. And we can do different tests to see if that's the case. Obviously, a physical exam is a first-line test to see if your lung has collapsed or not. But also, we may need confirmation. The easiest thing is either a chest x-ray, or sometimes we even have to go to a CAT scan to see the extent of what is going on and maybe understand why. So how do we treat this? Well, it really depends on the severity of what is going on. So for sometimes if it's a small pneumothorax, we may observe them, we may watch them, we may do serial imaging just to keep an eye on that pneumothorax. However, if it's a large pneumothorax, or we're worried about some complications, we may have to insert a chest tube, which will allow the lung to expand, and hopefully we can find out the root cause of what is going on to develop, or hopefully we can find the root cause of that pneumothorax so we can understand what is going on, and we can also make sure it does not happen again. So it's a very scary time. So it's a very scary condition to have. And obviously for this individual, I'm not his doctor. I don't know what happened, but I want to explain exactly what is going on. And obviously we give our heartfelt, I can't speak. Obviously we give our heartfelt condolences, and we wish the best for CJ McCullen and also anyone else who may be suffering from this condition as well. All right, guys. Perfect. All right, I think that's it. I want to thank you for watching. If you haven't already, don't forget to smash that like button, like, share, and subscribe. Join me next Monday. We'll see you then. Don't forget to come see Celebrity Gastro for all your GI needs. Have a great, happy, and safe holidays. I'll give you updates of my life and the cats next week. See you guys then. Thanks, guys, and take care.